Oral questions by members.
Kamloops Centre.
Thank you, Mr. Speaker. On the weekend, hundreds of Kamloops residents, women, men, and children, all rose up and made their voices heard about the critical shortage and crisis in OBGYN services in Kamloops looming with the resignation of 7 OBGYNs, the whole complement in Kamloops, over the next few months. Can the ministers please explain to this House, and most importantly to those residents of Kamloops, what exactly the plan and the timeline is to solve this crisis?
Minister of Health.
Thank you so much, Honourable Speaker. Thank you to the member for the question and his continued advocacy for people in his riding and in the surrounding region. Mr. Speaker, we know that these OBGYNs have submitted their resignation letter and that Interior Health is working closely with them on a transition plan. And to be clear, anybody who is expecting a child, has an imminent birth coming, is facing an at-risk pregnancy should always present at the Kamloops Hospital, at the Royal Inland Hospital, to receive care there. Mr. Speaker, Interior Health continues to work with this group of physicians on a transition plan. They have 90 days to undertake that work, but they are at the table, they are listening, they are talking to each other. Mr. Speaker, at the same time, Interior Health continues to recruit and is talking with up to 12 physicians who may choose to move to the Kamloops region, because we know that women and their families need the security of the care, the services that they need, and we are determined to support Interior Health and these physicians as they work together to resolve these issues, and that we can provide that secure, long-term continuity of care for people in the region.
Member supplemental.
Thank you, Mr. Speaker. Well, it's not just myself that keeps saying this has been going on for years. It's not just the 7 OBGYNs from Kamloops that say this has been going on for years. It's actually now a letter that the minister has got in hand of 130 OBGYNs as a signatory to the letter, saying that they support the 7 OBGYNs in Kamloops because they've been prompted by untenable and unsafe working conditions and a lack of meaningful response from the health authority and government. We have also raised alarms about this looming maternity crisis, only to be similarly dismissed, say the 130 OBGYNs. Surgical wait times will grow, care for high-risk pregnancies will be disrupted, and existing providers, including those outside of Kamloops, will be stretched even further. When OBGYNs are undervalued, so too are women and their health across BC. So I'll ask the minister again, what is our plan for OBGYN services, not just in Kamloops, but the whole province?
Minister.
Thank you so much, Honourable Speaker. And again, this is why the work that Interior Health is doing with this group of physicians and more broadly is so important. To hear the concerns, to listen to them, and my message to those doctors, to Interior Health, is I expect them to be together, to work through at the table, to work through some of these issues. Mr. Speaker, it also speaks to some of the bigger issues we are seeing in the strain of the healthcare system and facing a shortage of physicians in this province. That is why we have taken such extraordinary steps, like opening up a brand new medical school in Surrey, Mr. Speaker. Like continuing to streamline the credentialing of physicians who come from other jurisdictions who choose to work here in British Columbia, Mr. Speaker. This is the work we have to do to continue to strengthen and bolster not just OBGYN services, but other specialty services, family practice, primary care, Mr. Speaker, because that is what British Columbians need and deserve, and that is what this government will continue to prioritize and work on every single day.
Member second supplemental.
Thank you, Mr. Speaker. Well, it's almost like the OBGYNs never get listened to by this minister. We raised concerns about the 12 phantom new OBGYNs last week. The letter raises concerns, and yet in her first answer today, the minister clung to these 12 OBGYNs coming in as new recruits. Here's what the letter says from 130 OBGYNs, including the Vice President and the past President of the Society of Obstetricians and Gynecologists of BC. And it says, the provincial OBGYN community is small and closely connected. We are alarmed by the short-sighted reliance on locum physicians as stopgaps and an unrealistic plan to recruit 12 new OBGYNs to a community where current staff have been unsupported and exposed to unsafe working conditions. The use of these short gaps, stopgaps, rather than negotiating fairly with the current OBGYN group has not gone unnoticed. We will not be participating in these temporary coverage plans or in the supervision of new hires under these conditions. That's 130 OBGYNs, not a politician speaking. What does the minister have to say to that?
Minister.
Thank you, Honourable Speaker. Those negotiations take place at a table, not here in this House, not during question period. That is why it is so important that Interior Health continues to sit down with these OBGYNs, with other OBGYNs.
Members.
Because it is...
Member. Shh. Minister will continue.
Mr. Speaker, first and foremost, the priority must always be the patients, the families, the people. It is my expectation of these physicians, it is my expectation of Interior Health that they will come together to talk through these issues, to undertake the negotiations that are underway right now, holding the patient at the center of the work they do. I am confident that if they do that, they can come together. And Mr. Speaker, my commitment to them, to Interior Health, is to listen to them, is to support them, and to do everything that we can to support maternity services, not just in Kamloops, but in every community across this province.
Member for Kelowna Centre.
So Kamloops is not the only region driving out BC's healthcare practitioners. 4 psychiatrists resigned from Vernon Jubilee Hospital on Thursday, citing overwhelming workloads and lack of support. Will the minister order an independent public review of Interior Health and deploy emergency recruitment and retention measures today? Yes or no?
Minister.
Thank you so much, Honourable Speaker. Thank you to the member for the question. First, I just want to say thank you to the psychiatrists in Vernon who have provided exceptional service for years. Now, we know that 4 of them are changing their work. 1 is stepping down completely. The other 3 are changing the type of work that they do for various professional and personal reasons. Mr. Speaker, Interior Health is actively working with those psychiatrists, again, to finalize their transition plans. And at the same time, there are an additional 6 psychiatrists in Vernon who are ensuring that those services are there for people. Mr. Speaker, it's vitally important that people know that that care is there for them and that they should present at the hospital should they need it. Mr. Speaker, Interior Health will shortly be undertaking a recruitment campaign specifically for new psychiatrists in Vernon. That work will be announced soon, and that will be part of building the team, again, so that we can continue to see the building, the bolstering, the strengthening of our healthcare workforce here, not just in Vernon, but across BC.
Member supplemental.
We have a retention problem. They're citing workload and lack of support. First, the pediatric ward in Kelowna, next the OBGYNs in Kamloops, and now the psychiatrists in Vernon. Families are losing access to care. Frontline workers are burning out, and the Minister of Health is still pretending it's under control. Will this minister immediately launch an independent review of management and oversight within this health authority? Yes or no?
Minister.
Thank you, Honourable Speaker. It is no secret, I know, that the healthcare system is under strain, that things are hard. And Mr. Speaker, that's why we need to do everything we can to support every single physician, nurse practitioner, allied health professional out there who is working their heart out to support the people of this province. Mr. Speaker, we're going to continue that work to support those healthcare workers and to continue to build and strengthen the system. Mr. Speaker, I know the member understands that we have undertaken a review of all health authorities, looking at administrative spending, looking to redirect resources to the front line to support the work that people are doing so that British Columbians get the care when they need it and where they need it. And Mr. Speaker, we will continue that work. It will not end.
Leader of the third party.
Thank you, Honourable Speaker. I want to start by wishing all BCGEU employees the best on their first day back after 8 long weeks, and also acknowledge the damage done by the longest public service strike in BC's history. Mr. Speaker, this government wants us to be the economic engine of Canada. Well, in West Vancouver Sea to Sky, our engine is tourism. Whistler Blackcomb is facing 2 critical delays: a recruiter's license renewal needed to hire 60 foreign workers, and essential equipment stuck in the Port of Tacoma. Across BC, prospective parents are at risk of missing the window for IVF treatment. Single moms didn't receive their affordable childcare benefit, and restaurants and bars are reporting $250 million in loss of sales. The length of this strike means that BCGEU and PEA employees will now be buried under an avalanche of backlogged work. So to the Minister, what is this government's plan to address the backlog created by the strike? Not just putting liquor back on the shelves, but making sure that people can access the essential services they've been denied for over 8 weeks.
Minister of Finance.
Thank you, Honourable Speaker. We are, of course, pleased that we have a tentative agreement reached between the BCGEU and PSA, and also that things are looking positive with the PEA and folks are back to work. Our government respects the next stage of the process, which is the opportunity for ratification and the democratic process that this union must now go through. And I'll hold back any comments that I may have until after that process is complete. Thank you.
Member supplemental.
Thank you, Mr. Speaker. It's Integrity Week in the third-party caucus, and the damage this strike has done will be felt for months. And for what? Beyond the headlines and negotiations, this strike exposed something deeper: how fragile British Columbians are when the government forgets who it's here to serve. Mr. Speaker, with a leadership review imminent, I wonder about the governing party's political motivations in ending this strike. That mediation was required has cast doubts on this government's ability to lead. So I'll ask the government, was it the need to bring the labour movement back on side before the BC NDP's convention in November that finally broke the logjam on this strike?
Minister of Finance.
Thank you, Honourable Speaker. From the beginning of this labour action, our government has been clear that there's been 2 objectives. One is to ensure a fair agreement for these workers that deliver really important services to British Columbians, and at the same time to protect the bottom line and to ensure that we're being fair to all taxpayers. We're very pleased that we have reached a tentative agreement, and I'll hold back any further comments until after the space has been created for the unions to go through the democratic process and make their decision about the agreement. Thank you.
Leader of the Fourth Party.
Thank you, Mr. Speaker. He threw a rock at Donald Trump and got bulldozed. Ontario Premier Doug Ford antagonized President Trump by running attack ads against him in the United States. As a result, Trump raised tariffs by 10% and ended all trade talks with Canada. Having humiliated himself, Ford pulled the ads, but the damage is done. It was a reckless move. But unfortunately, Mr. Speaker, not to be outdone by Mr. Ford, our Premier is even more reckless. He's now launching his own anti-Trump attack ads in the U.S. These ads give Trump an excuse to retaliate with even more tariffs against BC when we're already hurting. Mr. Speaker, is the Premier's personal hatred for Donald Trump more important than our economic safety?
Minister of Jobs and Economic Growth.
Thank you so much, Honourable Speaker. Honourable Speaker, it's vitally important that all provinces make the case to Americans when there's tariffs and duties that are put in place that are unjustified and impact workers and families in our communities. Honourable Speaker, it's vitally important that we make sure that all Americans, our friends across the border, understand that right now the tariffs on British Columbia and Canada are higher than they are in Russia. It's vitally important for our friends in the U.S. to understand that every time they raise tariffs on British Columbia and Canada, it's going to increase the cost of housing for them in their communities. Honourable Speaker, we're going to continue to do that advocacy. We're going to continue to raise the noise to the federal government that we need strong action and we need it immediately. And of course, we welcome any supports that will help workers transition, Honourable Speaker, but our number one priority is to keep people working in our communities. So we will not apologize for raising our voice to fight for workers and fight for families here in British Columbia, Honourable Speaker. I welcome all sides, all members in this House to join us in that fight.
Member supplemental.
Mr. Speaker, the Premier is not defending BC businesses through this move. BC exports rely on American markets. 75% of all trade from Canada is with the United States. His petty ads will impede efforts to repair our relations, thus hurting BC's economy. He criticizes Trump, but you know who the Premier will never criticize? The dictator of Communist China, Xi Jinping. China interferes in our elections, holds our citizens hostages, and has even imposed 100% tariffs on our canola and seafood sectors. Chinese tariffs have decimated BC businesses. But instead of retaliating and railing against China like he does with Trump, the Premier rewarded our economic enemies in China with a multi-billion-dollar BC Ferries contract. Mr. Speaker, my question is for the Premier. Since he's denouncing our biggest trade partner, the United States, will the Premier also denounce Communist China and its dictator, Xi Jinping?
Minister.
Thank you, Honourable Speaker. We continue to make the case to our friends in the U.S. that the tariffs on our forest sector are having a disproportionate impact, not only on workers and families on our side of the border, but also across the border, Honourable Speaker. I don't know why this member continues to deny that that impact is hurting families in our communities. It continues to hurt families in our communities. And so I think all of us should be standing up for forestry. I know, because when I look across the way and I talk to colleagues across the way, they understand how important these jobs are to our communities, Honourable Speaker. We continue to make the case for all communities to lower trade barriers, Honourable Speaker. The Premier has made several trips to Asia to make sure that we can strengthen our trade opportunities. And on top of that, Honourable Speaker, we have committed to all of our partners across the country that we will do our part to make sure when their goods are coming to British Columbia that we help them find new markets as well, Honourable Speaker. So we're not going to apologize for fighting out for workers in British Columbia. I certainly hope that the members can turn their heads away from being so pro-Trump that they realize that they also represent people in this community, in this province as well.
Member for Kelowna Mission.
Mr. Speaker, we gave the new CEO of Interior Health the benefit of the doubt, but nothing has changed. It's still the same regime, the same broken trust, the same service interruptions as doctors walk away. It's clear there has been a failure to reset the system. What is the Minister of Health going to do today to start actually rebuilding confidence and trust for the doctors, nurses, and healthcare professionals who work in Interior Health and for the people and families who depend on it?
Minister of Health.
Thank you so much, Honourable Speaker. Interior Health continues to work hard each and every single day at the work of strengthening the healthcare system, of delivering care, excellent, exceptional care in our publicly funded universal healthcare system here in British Columbia. Mr. Speaker, the leadership team at Interior Health has my confidence, and I know that the new CEO, I know that she is working hard each and every single day, as is every healthcare worker in the Interior Health system. Mr. Speaker, over the past months and years, Interior Health has made some extraordinary strides in physician recruitment. They have hired 1,165 net new regular positions into all of the occupations in 1 year alone, just this year, 2025. Mr. Speaker, they continue to hire regular, active, casual staff. They have 94 signed offer letters from physicians, Mr. Speaker, who are choosing to provide care in Interior Health. 4 signed letter offers from psychiatrists, 3 signed offer letters for OBGYNs. Mr. Speaker, this is a health authority that continues to do the work, and Mr. Speaker, I will continue to support them in the work that they are doing.
Member for North Island.
Burnout is driving resignations across healthcare from OBGYN in Kamloops to psychiatrists in Vernon. Frontline healthcare workers are simply becoming demoralized. There are 147 psychiatrist postings listed on the government's own website. 10 pages of vacancies, proof that this isn't isolated, it's everywhere. Now we're up to 151. The reality of not having psychiatric care means more suicide, more deaths on the streets, more encampments, more safety issues for everyone from streets to homes. And all these issues will spill over from Vernon to Kelowna to the downtown east side. So when will the Premier, the leader of the so-called universal health care, take access to psychiatry care seriously?
Minister of Health.
Thank you very much, Honourable Speaker. Psychiatrists are an incredibly important part of the healthcare system here, providing care unlike any other specialist that people need. Mr. Speaker, that is why we continue to take every step that we can to recruit more psychiatrists, other specialists, family practitioners into our healthcare system here in British Columbia. Mr. Speaker, from the U.S. recruitment campaign to streamlining credentialing, Mr. Speaker, from reducing the administrative burden that psychiatrists and all other physicians face, Mr. Speaker, this government is going to continue to take steps. Mr. Speaker, when it comes to the U.S. recruitment campaign, we are seeing enormous successes. We've had over 1,800 job applications. Mr. Speaker, this includes 163 applications from doctors, from nurses, from allied health professionals, and it includes psychiatrists too. Mr. Speaker, we're going to continue to do this work to build out the system, and we are making progress. We are hiring physicians and nurses at unprecedented rates. Mr. Speaker, we are seeing new family physicians, over 1,000 new family physicians. Mr. Speaker, we have tripled the number of nurse practitioners. This is the sign of the progress that we need to continue to make, and we will not let up.
Member for Prince George, Valemount.
A local mother, Leanne, is a former nurse whose 17-year-old daughter's life was saved by saplings. Gave a simple warning, quote, "We are going backwards, not forwards." Saplings Mental Health in Fort St. John has been credited for saving young lives. Yet this government is cutting its funding. Those cuts that mean after a youth is discharged from hospital, there will be no immediate in-person mental health support left in this community. Will the minister restore this funding or admit that under this government, in the North, youth do not deserve access to suicide prevention?
Minister of Health.
Thank you so much, Mr. Speaker. The member brings up an incredibly serious topic, and that is the work of suicide prevention for all people, but particularly in this case, youth. Mr. Speaker, the loss of any young person is deeply tragic, and that is why this government has been so focused on the work that we will be undertaking to develop a young adult suicide prevention framework. Mr. Speaker, the supports that children and youth need are absolutely vital, and that is why, again, we have put so much into building out a system of care, of mental health, substance use supports, of primary health care for youth in this province, Mr. Speaker. We're going to continue to do that work, expanding the Foundry system, expanding the integrated child and youth care teams, expanding prevention funding in schools to help young people identify the issues that they face and appropriate ways to be able to deal with those. Mr. Speaker, we're going to continue this work because we know just how important it is. Thank you, Mr. Speaker.
Member for Skeena.
Thank you. It's really not good enough is the problem. People can't access mental health care anymore in this province, especially in the North. It's just, I don't understand why this government can't see that. One of my constituents, Cliff, suffered from a botched surgery that left him permanently injured. As a result, he lost his livelihood, his hope, and his dignity. And he has tried for years to get physical and mental health support from Northern Health in vain. He has tried everything he can think of. I have had other health professionals that have worked on him come into my office and tell me that his surgery was severely botched and he can't get any kind of compensation, he can't get any serious help. Nothing is being done for this man. Frustrated and defeated, he came into my office recently with a suicide note in his hand. And it was addressed to the Minister of Health in Northern Health. Nobody should feel like they have to resort to that. My staff shouldn't have to be doing that. They shouldn't have to be counseling people that are ready to commit suicide because they can't get access to basic health care in this province. The response that my office got from Northern Health, nothing we can do about it. Do people in BC now need to resort to dying by suicide to get this government to pay attention to them?
Minister of Health.
Thank you, Honourable Speaker. The subject of suicide is a highly sensitive and deeply personal thing and impacts families and communities across this province. And I think we need to be extremely careful about the way we speak and the way, of course, that we support people. Mr. Speaker, to the member, the situation she describes for her constituent sounds absolutely terrible, and I want to assure her that I would be very willing to work with her to determine what supports are available for this constituent and also ensure that he knows what avenues are available to him if he needs to talk to someone about the quality of care that he is receiving. There are processes for that, and it's important that the member knows as an MLA and important that people know. Mr. Speaker, this is why our government continues to invest in community counseling, bringing down the cost of mental and making it easier to access mental health supports. Mr. Speaker, that's why we continue to build out the mental health and substance use continuum of care. I know, Mr. Speaker, that the member has had the opportunity to visit some of these facilities and tour this, and I look forward in just a couple of weeks from now spending time with her in her riding up north so that we can discuss in more detail these very issues and be able to visit some of the facilities and programs that she raises. Mr. Speaker, it's incredibly important that we support people at that time, and that is why our government will continue to invest in mental health supports for people of all ages across this province. Thank you.
Member for Skeena supplemental.
Thank you. Northern Health has been aware of this case for almost 2 months. I brought this note to their attention and tried to get follow-up and tried to get some kind of resolution for this man. As the health minister, you should have been aware of it. Northern Health should have brought that to your attention. I was waiting to see if they would. It's like pulling teeth to get responses from them on stuff. So I just need to understand how on earth he is supposed to access care when he gets turned away every single time that he goes to the hospital. There is no mental health supports in my region. And I know the minister is coming up to visit. I can't wait to show her that there are no mental health supports. People can't access them.
Minister.
Thank you very much, Mr. Speaker. It is the responsibility of health authorities to undertake these conversations and to ensure that any patient or person who contacts them is aware of the avenues that are available to them, like the Patient Care Quality Office, should a person want to make a complaint or ask a question about the care that they have received. Mr. Speaker, I am committed to working with the member to ensure that she knows about those avenues and that she can help direct this person and any person that approaches her office about that channel. Thank you.
Member for Surrey White Rock.
Thank you, Mr. Speaker. Interior Health is in crisis. We've seen 7 OBGYNs walk out in Kamloops. Now we're seeing psychiatrists leave in Vernon. Fraser Health, well, we know the stories there. They're horrific. 12 to 14-hour wait times at Surrey Memorial. Delta Emergency closed numerous times. Langley, 8 to 14-hour wait times. Now we hear the stories about Northern Health. And I fully agree with the minister when she talks about the seriousness of suicide. And I believe she's very genuine in that. The problem on this side of the House is that when it comes to making commitments on programs such as saplings that has been proven to save lives, this government, this minister, has made a choice to cut those programs that are saving lives. So how can the minister justify her comments when we are seeing a program that has worked and her government, her ministry, her premier have chosen to close the doors and cut this vital program? Will the minister step in and provide that funding today, yes or no?
Minister of Health.
Thank you, Honourable Speaker. We will choose to invest in our public universal healthcare system every single day. Mr. Speaker, we will choose to continue to build more hospitals, more urgent and primary care clinics. Mr. Speaker, we will choose to build more cancer centres. We will choose to build the road to recovery. We will choose to expand that out across every health authority in this area. We will choose to build more, to add more family physicians into our rosters. Mr. Speaker, we will choose to add more specialists. We will choose to go to the U.S. and invite physicians, nurses, and healthcare workers to come and practice here.
Members, it's a very, member asked a very serious question, and he deserves an answer. Minister is going to continue. Please, thank you.
Thank you, Mr. Speaker. What we will never choose to do is build a two-tier private system.
Members, let the minister finish. Thank you, Minister.
And those are the choices that British Columbians have to make when they choose their representatives, Mr. Speaker. This government stands up for public universal health care. We will do that every single day. We will continue to build out mental health supports for children and adults. Thank you.
Members, the bell ends the question period.